Hello, welcome to SarkariTel.com and DiplomacyIndia.com. As India is passing through a brutal second wave of COVID 19, the entire healthcare system has been overwhelmed. It seems to be the crisis of the century. But in this hour of extreme distress, the global community has led a helping hand. Today, we have a very special guest joining us today, the Deputy Chief of Mission, Mrs. Rony Yedidia-Clein from the Embassy of Israel in New Delhi. Welcome, Excellency, to this very special broadcast and Shalom.
Shalom, namaste. Thank you for having me.
My first question will be: how is Israel helping in this crisis? What is the kind of supplies or help you are providing India in this hour of crisis?
Well, when the crisis actually came to a head, or started to come to a head, India had been dealing very well with COVID, and then all of a sudden you had this horrendous second wave. We reported about it to our headquarters in Jerusalem, and our foreign minister said that we have to do something. And so he put together a task force made up of the Ministry of Foreign Affairs and the Ministry of Health and other relevant ministries, as well as the private sector. And we put together a large budget for Israel. And we were able to buy all of the equipment that had been used and left by Israel getting through its second wave, and we were able to bring just about everything that was in our storehouses to India, and that includes 3 oxygen generators, which are good for either small hospitals or parts of larger hospitals. They're good for like a 120 bed hospital to provide oxygen for all those beds. Thousands of oxygen concentrators, ventilators, and all kinds of other equipment which is necessary in order to deal with the COVID virus, with the disease. And so we brought all of this in, and we're still actually bringing it. Not everything has been brought in. We started out with a small shipment, relatively small, that came on a passenger plane last week, and then over the weekend, 2 big Indian Air Force planes were sent to Israel to bring up to bring in the huge generators. They're really very large, and all the concentrators and everything. So those came in 2 flights, and there's still another flight which will be coming in the coming days of equipment brought together by the Israeli private sector, which also came together because the private sector made up both the businesses and private people wanted to contribute to the effort to help India. And so we have all of these things coming in together from the Israeli government and the private sector and private people in order to help India.
Surely, we are surely overwhelmed by your kind of support and help in this hour of crisis. My second question comes here is that since you were also hit by this COVID crisis last year, what was the strategy and how you handled that situation, and how is the present situation in Israel?
We we were also very hard hit, and there was one point when we were really quite frightened because it seemed like the numbers were going up very, very much. What we did was we ordered in advance, even before they were actually ready, from Pfizer and from Moderna, their vaccines in huge amounts. We paid a premium for it in order to have it in Israel. And then once the vaccine operation started in December, we went in very fast, very massively, full force. First of all, to vaccinate those over 60 and those with comorbidities, and then very quickly went down to 50 years old and 40, and then opened it up to everyone. But one of the things that we did, we didn't allow a single vaccine shot to go to waste. At the end of every day, when the clinics would see that everyone who had been invited in that day had already been come in and been vaccinated, and they were still safe 50 vaccines left, they would send out a message to the neighborhood by WhatsApp or text message and say, we have these vaccines, please come and take advantage of them. And that way, not one vaccine was thrown into the garbage can. Also, we had vaccination stations in every single village and town. A lot of neighborhoods in the big cities had vaccination stations. So everyone who needed to be vaccinated didn't have to go far away in order to do it. They could just make an appointment. It was very easy to make an appointment. We had a very good website, and they could get in and do it. Now, one of the things that we also had sort of prepared in advance is we have a health system which is older than the state. The state is 73 years old, and it's about 90 years old. And every Israeli citizen is registered in one of 4 health funds. Now, these health funds are completely digitized, and so they have complete contact with the patients, with the people who are registered in them, and so everyone is able to, through their health fund, to get vaccinated. And the digitation is very helpful because we can make sure that everyone does indeed get a vaccine. So all of these things together, working very massively, allowing people who aren't necessarily doctors and nurses, but they're medical students or nursing students, people who have medical experience from the army. It doesn't take a whole doctoral degree in order to put a jab in someone's arm. You can be someone with just a little bit of medical experience in order to do that. And if you have a doctor, on the site to make sure that if anyone has bad side effects or anything like that, that they're taken care of, then it also is much more efficient.
I have a supplementary question on that. What is the present state of, the percentage of population which has got vaccinated?
So it's around 80%. And we have been able to take off masks in Israel, unless you're going into a crowded area. But if you're just walking outside, you don't need to have your mask on. We're opening up much more of our cultural sites and restaurants and places of business. Everyone's able to go out much more easily now, and it's really becoming much better in terms of COVID.
What India can do better to overcome this crisis? If you have any comments to make on this.
Yes. So, as we mentioned earlier in our conversation, the entire world is coming to India's help in order to help it with oxygen and supplies that it needs in order to fight the sickness with people who are sick. But you need to prevent people from getting sick. You need to cut off the infection rate, and that means vaccinating. You have to you need to have a massive vaccination program to get to everyone possible in order to get the jabs in their arms. I think people are a little bit afraid of getting the jab, and so you need to have a public relations campaign that calms their fears, explains to them that the side effects, if there are any, are better than the disease, that it's important not just for people, for someone. I mean, a 20-year-old doesn't necessarily feel like he'd be in danger from the disease, but he is endangering his parents and his grandparents and people around him. And so it's very important in order to protect everyone around us. Everyone needs to get the jab. So it's important to have a massive campaign and an efficient, a good public relations campaign as well.
Yeah. That brings me to the end of this program. Thank you very much, ma'am, for joining on this very special broadcast. India, Israel enjoy a very friendly and cordial relations, and in this hour of crisis, Israel has certainly given a helping hand for providing this help. Thank you very much. This is Amay Sathi from SarkariTel.com and DiplomacyIndia.com signing off from New Delhi.